the face here. Then you will see here a greater momentum. Okay, that is the fat, nothing else. This is just the fat which has got lymphatics, and it is important to control the infection above here, because if there is infection, that will move like this and control the infection here. Okay, this here will be the greater momentum. Then now look at this. If you can hold like this, okay, then these are the intraperitoneal organs. Okay, intraperitoneal organs, not retroperitoneal organs. Like look, I can hold way above this. Yeah, this is retroperitoneal organ, but I can hold like this. This is intraperitoneal, this is retroperitoneal, and these are small intestine. Okay, this is liver, this is gallbladder. Yeah? This is right side, this is left side. Yeah? So then we will go through it. This is stomach, and this is yeah. Transverse colon. Yeah, you can look at. I can hold freely. This is transverse colon. Okay. Okay, just look at this. I will go through this. Yeah, what is this called? No.
Appendices feature of large intestine.
These are tinea.
Tinea coli.
Appendices, epiploicy, tinea coli, and ostration. Okay, that is just. Okay, now just look at this structure. Which artery is this? Inferior mesenteric artery. Yeah. Then it is supplying at the left side. Yeah. Look at the direction also. It is going towards the left side. And here will the left colic artery for the sigmoid colon and continuous superior rectal artery. It's complete.
Superior rectal.
Then okay, this is aorta. Look, this is fixed towards the body. Yeah. Why? Because this is retroperitoneal. Okay, so I can hold like this. I can take it out. Then okay, look at this. This is the common iliac artery. It is divided into, look, this is external iliac artery. It will continue as femoral artery. Then here will be popliteal artery, then tibial artery. This artery. Then okay, look at this. This is the internal iliac artery. Yeah. Then it will be divided into two parts. This is the anterior division, and this, look, this is the posterior division. Okay. And you have anterior division. Okay, I can show you. I think one or two. This is femur. This is ureter. Okay, look at this. This is ureter. Yeah. Uterus, your urinary bladder. I don't know. It might be formalin or it might be fungating carcinoma. You can diagnose. This is just say this is urinary bladder. This is uterus. Okay, here will be the cervix and downward will be the vagina. That's complete.
Covered by the broad ligament.
Yeah. Okay. Oh, okay. Let's just study this. Okay. Then look at this is the uterus. Yeah. Here will be the fundus, then body, then cervix. What is the length of uterus? This is important. Very important question.
Dimension, length, weight, size.
This is 7.5 centimeter. Okay. If you take just on the fundus and body, it will be the 5 centimeter, and cervix will be 2.5 centimeter. So it is ratio of 2:1. But that is only after puberty. But before puberty, the ratio will be 1:2. Okay. Just remember this.
1:1. 100 is all about 200.
Yeah. And if you look at the total space of this lesser cervix, lesser pelvis, the size is just about 5.5 inch. Okay, but the total, okay, look at this. What is infundibulum here? What is this? What is this structure? fallopian tube. This is fallopian tube. This is 10 centimeter. That is 10 centimeter. Okay, total 20 centimeter. This is 5 centimeter. Total is 25 centimeter. Okay, this will be about your size of 10 inch, but this pelvic size is just only about 5.5 inch. Okay, so this tubal structure have to be tortuous. So that's why this is tortuous. Okay, then this is femori. Okay, and femori here will be one opening. Okay, abdominal ostia, or you can say anything. Okay, abdominal ostia. You may be asked what is the size of this ostia. Just say 3 mm. 3 mm. Then after extension it will be open into this. It will be open into this uterus. Yeah, uterus body or lateral angle. Then but the size here will be opening of size will be only 1 mm. Okay, 1 mm. Remember this. And okay, we have already said this is the peritoneal fold. Okay, broad ligament. Okay, broad ligament. Upper end will be the fallopian tube, whereas lower end there will be vessels. Yeah. Then you have to identify here the ovary. Look at this. This is the ovary. Okay.
Almond shape,
Almond shape. This is ovary. Okay. 1 to 2 gram, 3 gram, anything can be. And okay, broad ligament has 3 or 4 parts. You can say 4 parts. Okay. This is mesometrium. Okay, this bigger one is mesometrium. Why? Because it is covering this metrium body. Okay, mesometrium. Then this that is suspending this fallopian tube will be mesosalpinx. Then okay, suspending this ovary will be mesoovarium. Then lateral to it, this will be the ligament. Okay, this is called suspensory ligament of ovary or infundibulopelvic ligament. These are the 4 parts of broad ligament. This is support of uterus, but that is secondary support. False ligaments. You know the parts. Yeah. Okay, then let's wrap it up. Just let it finish. Okay, you have this is the rectopelvic space, retropelvic space. There will be the fat, rectopubic fat. Okay, then this is the space between the urinary bladder and uterus, uterovesical pulse. And this is the space between the ovary and rectum, rectovaginal pulse. This we call pulse of Douglas. Okay, this is the dependent part of this our body. That means if you are suffering from ascites, okay, and you are standing erect, all the fluid will go towards this part. Okay. यहाँ रेक्टम छ
पछाडि त्यो चाहिँ ठिक छैन
हो
तिमीले माथिको के रेक्टो
होइन यो
त्यो भन्दा माथिको स्पेस
यो युटेर भेसाइकल
तिमी फेरि भन्नु
रेक्टोप्युबिक स्पेस स्पेस अफ रिच रेक्टो अथवा रेट्रोप्युबिक स्पेस अथवा स्पेस अफ रिच यस filled by the fat, rectopubic fat. Then there will be again one space behind this urinary bladder, between urinary bladder and uterus. So this is called vesico-uteropause or uterovesical pause. Then behind this will be the space between the uterus and rectum, rectovaginal pause or rectovesical pause. Okay. Recto-uterine pause. Recto-uterine pause will be superficial, okay, above, and slightly below will be rectovaginal pause. But you have to remember that recto-uterine ligament, yeah, it will be laterally, okay, laterally. This ligament is recto-uterine ligament, so that pause have to be suspended. Yeah? Below there will be the fascia, and laterally there will be pause of Douglas. So any fluid collected in this peritoneum or abdomen, yeah, abdominal cavity, when standing erect, will be deposited or drained into this cavity. But if you are sitting like this position is called supine position. That time the dependent space will be your posterior, right posterior pulse, or you can say hepatorenal pulse of Morrison. Okay, that is the most dependent pouch in supine position. But if you are erect, the most dependent part will be this. Okay, remember this the point that is complete.
अनि यसमा रेक्टो के भन्छ
Recto-uterine pouch or
युट्राइन अन्त मेलमा चाहिँ के हुन्छ रेक्टो
recto-vesicle आउँछ क्या.
किनकि युटेरस हुँदैन
त्यसैले तिमीलाई होइन एमसिक्यूमा कहिलेकाहीँ सोधिन सक्छ विच इज नोन एज द पाउच अफ डुग्लास भन्यो भने तिमीलाई कन्फ्युज हुन्छ रेक्टो भेसाइकल राखौँ कि रेक्टो युटेराइन राखौँ भनेर त्यसमा रेक्टो युटेराइनमै जाऊ है. त्यसैले फिमेललाई तिमी प्रायोरिटी देऊ भनेको त्यो वर्ड जस्ट कम्प्लिट